How do urban and rural populations relate to poverty rates? Breaking news on a topic that affects millions. The question on many minds today is, how do urban and rural populations relate to poverty rates? Recent data shows that poverty rates differ between urban and rural areas. As of now, rural counties have an average poverty rate of about 18%. This is slightly higher than the 17% average found in urban areas. Suburban regions show an even lower rate at 14%. This indicates that poverty is a pressing issue in both settings, with rural areas facing slightly more challenges. Rural populations account for around 20% of the United States population, which is approximately 60 million people. These communities often face unique difficulties related to poverty. One major issue is limited access to health care and social services. This lack of resources contributes to disparities in health and economic outcomes when compared to urban residents. For instance, rural hospitals and social support programs play a vital role in these communities. Reductions in federal funding for such assistance could lead to increases in poverty rates in rural areas. Urban poverty, while slightly lower on average, remains a significant concern. Factors such as high housing costs, job opportunities, and access to social safety nets play a role in urban poverty. Federal programs like the Supplemental Nutrition Assistance Program and the Child Tax Credit have helped reduce poverty in both urban and rural populations. However, recent legislative changes that reduce or restructure these programs could risk increasing poverty. This is especially true for the most vulnerable groups who rely heavily on such support. In summary, both urban and rural populations in the United States face poverty challenges, with rural areas showing a marginally higher rate. The relationship between population setting and poverty is influenced by access to resources, health care, and social programs. These elements are essential for addressing poverty in all communities.